Let's talk about the rapid sequence of intubation, the steps that you have to follow, and the medications that can be used. We intubate a patient whenever we feel that they cannot breathe on their own or that they're having impending respiratory failure. So we basically override the respiratory system and enable the patient to breathe. To remember the steps that you have to follow, remember SOAP ME. Oral suction should quickly be started, and this removes the fluid around the mouth and inside the mouth. This is an important step to prevent aspiration. Oxygen. If the patient is able to breathe currently, you should load them with oxygen, and this buys you some time in case you fail to intubate the patient multiple times. The intubation equipment should be readily usable. Positioning. The patient should lie on their back and you should stand behind the patient's head. Monitoring and medications, which we'll talk about in a second. And ET carbon dioxide. Using the intubation equipment, you should monitor the carbon dioxide coming out of the tubes. If there is good amount of carbon dioxide coming out, it means that the intubation is successful. To remember the medications that are used, remember to very calmly engage the respiratory system. Vicuronium is important, and this is a muscle relaxant that relaxes the diaphragm and the chest and hands over the ventilation process into the ventilator machine. Cisatracorium, which is another muscle relaxant. Etomidate, which is a short-acting analgesic agent, and this helps putting the patient to sleep. Rocuronium, which is another popular muscle relaxant. And finally, Sux or succinylcholine. This medication paralyzes the patient and enables easy ventilation. Use the link below to get access to the full Mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other